Good afternoon. We're in for a spooktacular Halloween edition of THCB Gang. I am Death. Although Death, for some reason, with an accent, not with a side, because I couldn't find a side. Your host. And I want to bring on my wonderful THCB Gang for episode 30 on the 29th of October. I have for your delectation delight the Incredible Hulk, otherwise known as Raj Agrawal from Jefferson Ventures. With a coming Kim Ballard, all the way from Cincinnati, but showing his Pittsburgh colors. Vince Corredis, another sportsman, showing the finally world champion Los Angeles Dodgers. Devin McGraw, coming all the way from the Northern California now. I can't remember what she's wearing, but we'll see in a second. The Wicked Witch of the West is Lagia Riccardi, CTO of Caring Health. And finally, Jane Starrison Khan. So let's go live with the gang in our Halloween spectacular. Ooh. So Devin, tell me, who are you? You're Heidi. No,
I'm not Heidi. I think I'm Mother Nature. I'm trying to be Mother Nature. So don't mess with me. Don't mess with Mother Nature.
Messing with you's already happened. My eyes are supposed to flash. And Jane, are you a nasty girl?
I'm an early Pennsylvania voter, because that's my state. And yes, I'm a nasty women voter, but we voted early.
Fantastic. And I want to see if Raj can keep his Incredible Hulk fists up with the whole episode.
Well, I'm hoping when you put your sides down, then I'm putting my fists down. That's the plan.
Well, I may do a costume change at some point, because it's all very well being deaf, but I can't see you. All right, so I think Zoya is going to join us in a couple of minutes, and I wonder what she's going to come in and looking like. So we'll be very excited for that. All right, but now let's figure out. It's a scary week. It's very scary. I'm sure many of us are scared about what has happened and what's going to happen. So why don't you tell us your thoughts about the week so far in health technology and spook them, Kim?
Well, I'm feeling much better because I just saw that the White House announced that one of their accomplishments is that they've ended the pandemic. So I think we can make as much money as we want now.
Devin,
let's go home.
Devin.
So you might remember that 2 weeks ago when I was on, I said, please give me some rules to read so that I don't, drive myself crazy waiting for this election. And they granted my prayers today. 2 big rules issued. Not quite in the Federal Register yet, but a price transparency rule out of CMS and ONC's delay of the info blocking rules and some further delays around the new certification requirements came out.
How many pages?
It's actually only 88.
Oh, that's
I was going to keep Devin going for the afternoon.
No, that's not the price transparency rule. That one's probably much more voluminous, but really it's just deadline extensions in the ONC rule and some typo cleanups. So it's 88 pages double spaced. So it's manageable. I read it this morning in an hour.
Half an hour for you, Devin. And then there's some CMS rules I heard about as well, which we'll talk in later about COVID-19, which I heard interviewed on my favorite person, Stephen Verma, was interviewed at this. But yeah, we still have to figure out what your hat's doing there. It comes and it goes. Is the hat real in the background fake?
It's fading in and out. No, this is what it actually looks like in Washington, D.C. So I was scouring the news for something positive, and my positive news really, I think, goes along with Jane's costume, which is about early voting. And in particular, the Washington Post is reporting that Generation Z and millennial voters are surging in terms of early votes. And they're hoping, I'm hoping, they're going to break all records. The last records for voting for them were in 2008 when Barack Obama was elected. So there seems to be a lot more, not just voting, but activism among the youth on a whole variety of topics, many of which intersect with healthcare.
Vince, I guess the news is that your team won.
Well, my costume, I think, probably needs a little explanation. I am an elated and totally disgruntled Dodger fan. Okay, the elation. We won the World Series after 32 years, okay? And I grew up in Los Angeles. I have memories of being a kid. I'm 11 years old, lying in bed. My parents think I'm asleep. I've got the transistor radio under my pillow and the dog on my bed. I know that dates me, the transistor radio part. And I'm listening to Vin Scully announce the Dodger game. Okay, this is my heritage. So the F up of the Dodgers, for those of you who are not aware of it, in the 7th inning of the last game, Justin Turner, the third baseman, was finally, I guess, diagnosed with COVID. And he was pulled from the game appropriately. And the Dodgers won. And then he goes down onto the field, the dumbass. Disgusting. There's pictures of him hugging his teammates, kissing his wife. So in honor of this, I have created, for the first 100,000 buyers, my commemorative Los Angeles Dodgers COVID Zoom background available. But there's a health policy point here too, that I think it illustrates the polarization. And Twitter is always a great way to get a pulse on the world. And there are lots and lots of comments. MLB, Major League Baseball, came out with a condemnation, and there's an editorial in USA Today saying, Justin, what were you thinking? But you read a lot of the individual comments, and they're very supportive. Like, this is a guy who's been waiting for years. The Dodgers haven't won a series in 32 years. Of course he should be down there. And that really illustrates the pervasiveness of the mood in our country, how divided we are. And I'll stop there. Thank you for the chance to vet.
Raj, this week. Put your gloves back on.
I gotta put my gloves back on. So I was on a call with a friend, colleague who's in Ottawa, and she was alarmed by the number of COVID cases that were happening in Ottawa, right? And they had, in the entire state of Ontario, their caseload has gone up to 800 cases in that state. And she was alarmed and said, oh, everything's terrible. And I said, no, but Canada's doing really well. She's like, no, it's terrible. And it just gave me pause for thought as to what's bad, and what's bad, and what's good bad, depending on the environment that you're in. Because quite frankly, that's not terrible. I mean, it is terrible, but in terms of what we're experiencing here and in other parts of the country, and then the 4 Atlantic states in Eastern Canada have not had a COVID case for 2 months. And it just brought me back to reality of how badly we are managing this disease in this country.
So Ontario is rather better than South Dakota or somewhere like that.
Oh, and the other piece of it was that, and I said, well, why is that? And she said, because we respect our elected officials and our public health experts in this part of the world.
Jane.
Hey, so my mom was from Ottawa, Raj. So thanks for the call out to my Canadian family. I want to be the yang to Lygia's yin, as we often are, Lygia and me. So the piece of data that is keeping me up at night, and a lot of you, is that the American Psychological Association's 3rd volume of the Stress in America survey came out last week and found that 2/3 of US adults have political stress as a significant source of stress right now. 68% of Americans say the presidential election is a significant source of stress. And I think that's true. So, it's how we're living.
You should do a poll of the gang. Is there anybody here who doesn't think it's a source of political stress?
Jane, was that?
Tim is relaxed. Tim is fine.
Jane, did that poll look at kids as well, or just adults?
They didn't look at kids in this one, but earlier, after the death of George Floyd, 2 weeks after, APA did a study and looked at parents and kids, and a significant source of stress in terms of social and civil issues, not so much the presidential election in the summer. So they are looking at kids too. But that was related to 2 weeks after George Floyd's
I'm just
murder.
going to share what my 8-year-old son said to me about 4 months ago. He came into our room and he just looked white as a sheet. And he said, "Daddy, I just feel like I'm living in an alternate reality. Doesn't feel real right now with everything that's going on with COVID."
Wow.
And I said, "Yeah, I get that." And then he added, "But what's even worse is that Trump doesn't care."
Well, oh, Zoya, you're here. Sorry, who are
I
you?
am.
Hang on,
Matthew?
who coming in as?
I was trying to do your accent, but I genuinely can't. I am the man, the myth, the legend, Mr. Matthew Holt himself. I've
too
tried
good.
my best to be my boss for Halloween. But in all seriousness, something that I'm really concerned about is basically what's going to happen with female women's reproductive rights in America with the recent nomination of it's just been such a crazy time. Lygia, I know you were talking a little bit about how millennials and Gen Zers are showing up to the polls. I think that this issue is so important to more of like the young crowd, and just what are the rights around, reproductive health, birth control, even maternity care and maternal care. So that is something that I'm very concerned about with the judge's current nomination to the court. So that is something that I've been following. Don't know what's going to happen there. Very scary.
Well, it's more than nominations, or it's a confirmation, right? She was confirmed twice, once by Justice Thomas and once by Chief Justice Roberts. Because I don't know, the one that was done, the super spreader event in the White House wasn't official or something. But anyway, it's clear.
No, that was pre-confirmation hearings.
Right.
And then now that was post-con. I mean, she has been confirmed by the Senate.
Confirmed.
And so that the second event was to celebrate the fact she's Justice Barrett now.
She's Justice Barrett, but she was allegedly sworn in by Justice Thomas, who may not be my favorite justice. But then the next morning she had to be sworn in again by Justice Roberts. I don't know if they got it wrong or something.
I don't know. Or they wanted to do it twice for ceremonial purposes. Who knows?
Who knows? Who knows? All right. Well, that's give us thoughts. So be warned, everybody. I will be asking for your spooky Halloween forecasts for what happens on Tuesday and beyond Tuesday. So get ready for those state counts. We're going to note this all down and come back in a week or two and figure out who got what right. So be warned. But meanwhile, I think the thing that has clearly happened in the last week or so, maybe in the last 10 days, is that ever since Trump got better, we've now seen this new rhetoric from the administration that basically the pandemic is under control, or you can't deal with it, as Meadows, the chief of staff, said, or the most recent press release said that has been dealt with, it hasn't already been solved, which Raj doesn't exactly square with your from Ottawa, your colleague from Ottawa. Meanwhile, you're seeing in several cities, a massive surge of COVID cases coming into hospitals. So where do we think we are in this? This is the third wave, or the first regional wave in the Midwest and some parts of the South and elsewhere. Where do we think we are again in the state of COVID, given what's happening with the stock market? Seem to thinking this time that things are getting serious again.
Do you have a beeper to blank out what I want to say?
Go on. You can say that word. It's not a family show.
We're fudged.
We're fudged.
We're fudged. But I mean, beyond being fudged, part of the issue, if you go back to there are two things going on here, as I can see. One is early on we were going to socially distance and lock down and flatten the curve so that we could manage this in hospital capacity. Some cities clearly didn't manage to manage it. I mean, New York City and others were in real trouble. At one point, several hospitals in several cities in the South, Texas and elsewhere, were overwhelmed. We seem to have got a bit more of a handle about how to treat COVID, and obviously the death rates are going down. There's some indication that the people coming into the hospital are younger and healthier than the sort of first wave. Does anyone have a handle on where we are in terms of the sort of the acuity of the people coming into the hospital now, and the level of capacity of hospitals in places like Salt Lake City or Wisconsin? Does anyone, Vince, have you been following that on the fudged issue?
I have not.
Okay, well, I've managed to quieten the gang here. My impression is that there's a lot more confidence that we can deal, that hospitals can deal with this, and death rates are going down. But this is sort of flipped into the side that we're now a lot further into the pandemic, and the willingness, particularly not just the people on the right, the willingness of people overall to do whatever it takes to shut down society seems to be, we're really going to test how much that willingness is left, and not just in the US. You're seeing in Europe, Germany is about to close down for the month of November. I see some Wales close down completely. The country of Wales, which is a separate country in the UK. Raj will tell you his British constitutional history about that. It seems to me that we're really going to figure out if this thing goes away, and yet we have news about vaccines, news about remdesivir. There is quite a lot going on as how do we treat the pandemic continues to unfold. So I don't know how's a thought about where we really are beyond that we're fudged.
Yeah. So Matthew, let me talk about our health system and what we're thinking about right now. I'm
putting my axe down, Raj. You want to put this down?
Number of cases. You see, I've got it here as well, right?
Yeah, good.
The number of cases are going up, right? We were at a peak in April in terms of cases that were admitted to our hospitals, and it went right down to 60. Number of COVID patients, and just in the last 2 weeks, it's gone up to 120. So this isn't a blip. This is a real trend in terms of cases of COVID patients that are admitted to our hospital. We're nowhere near, the challenges we had with ICU and ventilators and so forth a few months ago. And we are feeling much more prepared. Just psychologically prepared, I think, is important. Also PPE prepared. And what we're saying right now, and we don't know whether this is going to happen or not, but is that we're not going to shut down all of elective surgery. We're not going to go completely into what we did in the first phase. And we are going to try and get ahead of this in whatever best way we can. And interestingly, there was, I don't know if anyone saw this in the New England Journal, there was an article about kind of continuing elective surgery in the COVID sort of second phase. And it was really interesting. I love the New England because they really are innovative, and they kind of had 3-point counterpoints of, here's a case, and continue surgery, slow it down or completely stop it. And you had 3 people who were making really cogent arguments, which made my job really difficult because I was hoping I could just say, oh, it's A versus C and so forth. And then there was a vote on that as well. And it'd be interesting to see what the results of that vote comes from. So, I personally, and sort of as a health system exec, feel more confident than we were in February or March, just because of everything that's happened. But, still, no one knows, right? But that's how we're feeling, I guess, in terms of psychologically and how we're preparing for it, certainly from a Jefferson perspective. And, we're not in the throes of what's happening in Wisconsin and other parts of the country right now.
But even in those areas, Jane?
Yeah, I want to give the consumer patient side to complement what Raj is talking about. So I've been tracking how consumers and patients feel about returning to healthcare. So you may offer elective surgery, but I've been tracking TransUnion, who looks at credit worthiness, both for the hospital side and the patient side. And interestingly, TransUnion's been doing monthly studies since March, asking consumers, are you comfortable returning to healthcare settings? So we hit the low, which was a good news that only 29% of people said in August they wouldn't return to healthcare, but an increase of 3 percentage points in September to 32%. So it's rising, consumers saying they will not return. Now, we don't know who those people are by demographics, but there is still, say, a third of American adults who say, I'm not going back, even if you offer me the arthroscopy or whatever. I think people are returning more for cancer care now, which we saw early, they weren't. But in terms of the electives, where in a fee-for-service system, largely, not a value-based system, but more fee-for-service, it's going to be a problem for hospitals to get out of negative margins in the fourth quarter of 2020 this year.
And Jane, we see that with bariatric surgery, which is what I do. You know, our numbers are way down. Plastic surgery, our numbers are way down, because those are things that can wait. And people are saying, why take the risk? Cancer surgery has never been busier, right? We're just as busy with cancer surgery. Absolutely.
So for me, the biggest risk in this whole thing is that we're not, as a nation on the whole, on the same page about even agreeing on simple things like wear a mask. If we were all pretty much on the same page about that, I think it would be interesting to say, okay, and armed with this new knowledge, how are we going to manage new cases? But I guess the problem that seems even bigger to me than COVID, frankly, as we come into this election, is that there are different versions of truth. There are like different facts that people are relying on. And when that's the underlying issue, it almost doesn't matter what the topic is, because it can just get spun in any way possible. And right now we're seeing the sitting president of the United States doing that. And I think our best hope, honestly, is to move. I mean, the election is part of it. It won't be all of it. If Biden is elected and is able to help us bring up our level of trust in core institutions like government and science and even banking, if we don't trust those basic pieces of the American sort of infrastructure, then we're really, what was the word, fudged.
I think to
I live in a state where we have a very popular Republican governor who has been, one of the most trusted people about dealing with this. He, does a lot of press conferences. He's been an advocate of masks, advocate of other measures. And yet we've been setting records every day for the last 2 weeks. And he continually says, we need masks, we need to do that. But he knows he does not have the political capital. Even he doesn't have the political capital to put in farmer bans. He's pressing everything down to the counties, saying, well, it's up to the leaders of the counties to really get anything tougher, because he tried to be tougher and got his head, handed to him by his, far right legislators. So that's what we're facing. Even when you have the politicians that know the right thing to do and say the right things, there's still that minority of people that are just not paying attention or not going to abide by the rules.
Yeah, I mean, I don't think we should expect that to change. If Biden is elected, I don't think that division goes way deeper than Trump. I mean, he just empowers folks, but they're not, his supporters are not suddenly going to say, oh my gosh, I was wrong.
Dave Chappelle has an interesting comment. I forget which thing it is. He said, Trump didn't start this stuff. Trump may symbolize it, but all these things that you're complaining to him about him, he's just representing what's already there. He's not the cause of it.
Yeah.
So how do we get at this?
The European numbers are way up too. I mean, that's not a Trump issue. I'm just playing my friendly devil's advocate role here. I mean, the whole world is struggling right now, except from what I can see. Asia has still got still has it pretty well tamped down. New Zealand.
New Zealand's been amazing.
New Zealand's an island. They have a lot of advantages that most places don't.
Yeah.
Hawaii's doing pretty well too, but that's a unique situation.
What I find really interesting is how even lockdown occurred in the country, right? Like California went on severe lockdown with, every non-essential business shutting down. And then you have places in the Midwest where mayors on counties are battling of even how to lock down. So our cases are all over the place and our symptom checkers are all over the place. Like recently I heard a doctor say the virus is basically it's morphed and the symptoms we can basically handle them better. And it's like, is that because now what we're looking for, or is the science improved behind it? How is the drug development around this going to occur? I mean, just even how lockdown happened and now how people are looking for symptoms, why is it so asymmetric across the board?
But I agree with Jaya. Look, if Biden wins, I worry about what the fallout's going to be, right? There's going to be protests. There's going to be kind of almost intentional super spreader events. There's going to be well, this is a conspiracy theory, the Chinese virus. I actually worry that it's not going to be all okay, whether it's next Wednesday or next Friday or whatever, that, there is this core, and they're going to react, right? They're going to react, I think, in the same way, whether Trump wins or Biden wins. And they're going to react with protests, which are going to be against science and against reality. And that's what worries me a lot.
I'd go further, right? Because despite Biden winning, I mean, if Biden wins, which is a big if, right? We don't know. There's the issue about the electoral, accepting election results as a whole. But then you've got, as we said, nothing happens till January the 21st, which gives a good long period of time for who knows what to go on.
January 20th at 11:59.
It's great that we had the lawyer on the show to get us.
I'm just saying, we had to be out of the building.
Yes.
All right. But there's a good long time for all kinds of stuff to happen, right? Number one. Number two, we don't know what the Senate's going to do. I will ask everyone by the end of this. I'm going to get your forecast and hold you to it by the end of this show. But nonetheless, we don't know what the Senate's going to do. And then somebody has to go in and take over these institutions, particularly the CDC, which has been almost decimated, figure out who the new leader is going to be, put him in, put a new team in. I mean, we're talking a long time before we have a kind of classic democratic, scientific, promoting approach. It's not like Obama coming in and being able to put up a team together to do Ebola immediately or swine flu, whatever they did. We're talking a long while from this. And meanwhile, as you said, we do have a lot of people in the country who don't believe this is the problem. And I run into people in my little northern, liberal town of Northern California who say, well, I'm wearing the mask, but I don't really believe it. There's a lot of question about, is it all super spreader events, or is there, aerolization of them? I mean, it is aerolized, but is it likely to be aerolized, which doesn't make much of a difference if you're wearing a mask compared to if you're, droplet-based infections. There's still a lot of confusion out there, and the confusion is only is been driven by two things. One is, as Lygia pointed out, the sitting president now says that it's all COVID, and you shouldn't care. And we've cured it, despite the fact that the rates are increasing through the roof. And then there is still conflicting evidence about which treatments are effective. We just had the remdesivir WHO trial, which said it wasn't, and that's been contradicted by Gilead, the company that makes it. They said that trial had all these other problems in it. Eric Topol has been going back and forth on Twitter about this. You have, and you still have, as I said, it's not clear what the impact is because, frankly, Rogers has said Jefferson and Philadelphia's healthcare system can probably manage where it is. San Francisco's, we're seeing an uptick, but it's nowhere serious. But you never know. You might have, several healthcare systems which do get wiped out. And as we've all pointed out, Germany, Spain, parts of the UK are back off the charts again, even though many of those places have been, relatively calm and relatively sensible about how they've dealt with it. So we're probably thinking, realistically, ignore the election, which obviously has huge impacts on the rest of life. This may not change for many, many months in the US, and maybe longer. I mean, so I don't know if people are kind of not focused on that, but it seems to me that we're in for a long haul here.
No, I think October 1st. I started a new journal, event journal for my cognitive therapy, personal cognitive therapy on October 1st this year. I think I told Lygia recently, I think we talked about this because I journal every day just for journaling. And I said, this is my year-long journal. It will take me through to September 30th, 2021, because I have a home in Brussels now that I can't get back to. And my husband's still here with me. He came home March 20th, and he's got to get back to work. And, he's just going to have to go back in the COVID-ridden Brussels region, which that and Flanders are burning up in Belgium. Mostly due to more young people who just can't keep their flies shut. I mean, it is what it is. Pandemic fatigue, and it varies where you are, but it's young people in universities and colleges and whatever. So, but no, I think it's going to be fourth quarter next year. And I read Standard & Poor's about this. You look at big employers telling employees, you're not going to come back to offices before next July, if then. So, I mean, it all kind of says, and then Moderna and Pfizer saying vaccines probably won't get to mainstream folks until next June. That was the latest rate for Moderna and Pfizer. So you figure if there are 2 doses for mainstream people, you figure June, July, August. I'm looking at a year.
I don't want to be really negative, but I read that the positivity rate in Wisconsin was 20%. And my understanding is that once it gets to 50%, then actually herd immunity kicks in. Is that the way we're going to go here? That we are going to have million+ deaths, and we're just going to end up, through no intent, maybe we're going to end up with herd immunity, and there's going to be vaccines, which is going to be the secondary, but that's the way this is going to kind of play out.
Well, can I ask a question about that? So do we know actually how well herd immunity will work with this virus, given that the window of immunity after you've gotten COVID is actually fairly small? Like, what do we know about people's ability to get get COVID-19 again, given that herd immunity with a virus where there's sort of much more is known about how long immunity lasts, makes sense to me. Herd immunity for this virus makes a lot less sense to me.
Well, there was I was on the radio this morning in the UK, there was a study of 350,000 people where they looked at the people that were positive with antibodies in April, and then they looked at them again in June. And out of the ones that were positive, only 2/3 still had antibodies in June, just 2 months later.
Yeah.
That's the best evidence we have right now. That's it, right?
And meanwhile, I would add, I don't think that the vaccine is going to be a silver bullet either. I mean, even when it does show up, who knows how good it's going to be. But another important thing is back to this issue of people being very divided. I see this kind of general fear of vaccines permeating areas I just never would have expected. And that scares me. So if we had a great vaccine that many people were willing to stand behind, I mean, honestly, if the Trump administration were to have tried to roll one out, I probably wouldn't have trusted it. Yeah. But, if there's one that comes out later on, there's going to be a higher than we might like proportion of the population that's just going to be unwilling to participate.
Well, just look at what happened with measles, mumps, rubella, and autism, and that wasn't politicized, right? That was just, some people thought it caused autism, and so didn't give it to their kids, and kids died of cerebral measles, right? I mean, yeah, I get it.
But I mean, so obviously it's the case though too that okay, so you may not take a vaccine, you may put your own self or your child at risk, but you're also putting other people at risk, and that's the part that's really problematic, as with many other diseases too. But still, that's where it gets really hard. Yeah.
My understanding is that the target rate for success the FDA is targeting is 50% for the first vaccine. And I presume we're going to get statistics over time that show, it's 50, 60, hopefully 70, 80, 90% effective. I don't want to be the first one in line to get a vaccine, but 2, 3, 4 months later, I suspect, especially if we get some encouraging effectiveness statistics, I think the resistance will go down dramatically.
I think also just to understand, I'm confused about even what herd immunity means in terms of, we found that 75% people who've had the illness, have had the virus, also have other comorbid issues. Like now they have respiratory illnesses. Now they have, something else propagated throughout their system. So even if we get herd immunity, we still have all of these other illnesses now to deal with in these people. I mean, close friends are dealing with asthma, adult onset asthma after they had COVID-19. So what does herd immunity really mean if we just have another whole host of illnesses coming?
There was an article, I think it was in the Post this morning. It said that, there are 3.5 million people who are known to have recovered from COVID out of 8 million people that had it. And it pointed out, we don't have a data strategy to really track what happens to people. So we don't know how many, we barely know how many people have it. We don't have a good idea of that really. We're not doing anything about, well, how many people get totally better, get better with severe complications, get better with other complications. It's another example that we are fighting this thing from behind without the data that we need to really understand how to manage it.
So let me inject two more things which have happened recently about this. So one which is coming up, right, which is the ACA hearing, And as has now been pointed out clearly by our legal correspondent, Devin McGraw Esquire there, Amy Coney Barrett is now on the Supreme Court. We'll hear probably the election, whatever the election, if there is an election case afterwards, but certainly, a week or so later, we'll hear the first, what is it, California versus Texas, which is the reboot of the ACA. I'm going to win $100 from Marguerite or Gary if there are more than two justices vote to knock it down, but I think it's going to be much more than that. So we have that issue coming up. The other thing that's happened was that the CMS announced a bunch of rules yesterday about payment for COVID testing for Medicare, and they also, Tim Verma was on the radio talking on NPR talking about the payment for people with the uninsured out of the CARES Act. Who was going to pay for care for people with COVID? And I thought there were a couple of interesting points that they said that the vaccine is going to be free and make sure that everyone on Medicare and Medicaid can get it, but also it'll be free. The health plans will have to make it free for everybody else, which I'm not sure. I guess they can regulate that or not. Maybe
that's a good question, because I'm like, if they could have only regulated some health plans around the interoperability rule, where's the authority for them to sweepingly make all health plans across the nation do this? I don't see it.
I assume they were going to make it a preventive service that had to be paid for at 100%.
But if it's preventive service paid for under the ACA and the ACA is knocked down, how do they enforce that?
Right.
And then, of course, the other thing, which was that if it's so damn important that if you have COVID, that it shouldn't be a pre-existing condition, or your care should be free at point of service, why is COVID so special? And therefore, shouldn't everybody have that for every condition? I mean, the logic of this is not entirely, and this is obviously going to play out, because don't forget, even if Joe Biden gets in, he's talking about a public option. He's talking about expanding Medicaid. He's not talking about single payer. I mean, obviously, going to be significant changes, but that to me that those two issues are going to come up, and we're all sitting here saying we see no way this thing goes away for a year, at least a year, and maybe more. And it's going to have a massive impact on the healthcare sector, but also a massive impact on the economy and how we're all going to live. And I think, Raj, you mentioned it. Kids were up. Kids, their psychological. We've seen psychological stress. We've seen massive funding for telehealth services, especially mental health, which we've been tracking over the last few months. Continue to increase. But it seems to me that it's kind of unprecedented in a more modern world that we live in to see how long we're going to be able to endure this level of stress. Now, I know people say, the greatest generation lived through World War I and World War II, but I mean, this is for people of our age in America, this is an unknown.
I honestly, I would trade another year of COVID stress for not another year of political stress.
But as we said, you don't clearly get rid of it, right? I mean, there is some possibility that the Trump rallies and the guys when they pick up, if Biden wins big, that kind of goes away. I didn't see too much. We saw some of it after the Tea Party, but nothing like what we're seeing now. But I mean, you're still talking about people going to the polls with guns in Michigan, and this could break the other way. This could be like the late 60s, where you see much more domestic right-wing terrorism as opposed to the left-wing terrorism we saw in the 60s, early 70s, where there were frequent bombings and the Sinhalese Liberation Army and the Weathermen, and you could see that kind of stuff crop back up. I mean, it seems to me that we have the tinder is dry for that, even if Biden wins. And by the way, it's no certainty he's going to win.
Yeah, and I would add the tinder is dry in a variety of ways, but one of them is that we have this increased reliance on or comfort with social media, partly because we're all sort of shut in and we have no choice but to be on our devices. But I think it really is a lot of the extremist groups and so on Facebook and other platforms that are enabling people to kind of go down these rabbit holes of extremism. And that is yet another thing that worries me, or just the general sense that people can choose. There's no common thread. Different people find their own communities online and follow them, and they have totally different truths. So for example, I live close to the Supreme Court. You have people out there like picketing with signs that, like maybe I don't understand something. And my daughter, who's 15, is like, well, that's a meme on TikTok. And I'm like, okay, but those people don't know that. Like, you're not communicating at all.
It's like the Trump arguments at the last debate. Like, if you weren't watching Fox News, you didn't know what he was talking about half the time.
That's you brought up like whether it was World War I or the Depression or World War II. In those times, you get your newspaper in the morning and you'd probably talk to someone about it, and that would be it. Then you'd get on with the rest of your day. Right now, it's as seductive. This is in front of us all, and we want to know more, and we want to know more, and we go down these rabbit holes and not know where we are till we're too far down sometimes. It's that's what I'm really scared about in terms of just our community of we're being manipulated, quite frankly.
Well, and interesting enough, we did have the CEOs of Twitter and Facebook, not Facebook, Twitter, Google, and there was one other on. I know Jack Dorsey's beard was, down to his belly almost. We're on, and Ted Cruz was ranting about them, this whole issue about are they being unfair to conservative media, although the data suggests, in fact, that they're only promoting the influence of conservative media. But nonetheless, we know that we're aware of this social networking thing. We don't have, there have been several commentators saying, we're putting a change into the way we handle free speech and discourse that, into a medium, into a technology, which we just don't know how to handle. And there seems to be very little clarity about what we're going to do about it. And I don't think much is going to change in the next little bit. So again, that's something that to me is baked in. And, maybe there'll be a note on your Twitter thing saying this isn't a verified tweet, or this isn't a verified piece of information. If it's coming from Trump or whomever. But the underlying pattern, I think, is set for the next little bit, and maybe it'll dissipate if we have, Biden election and appeal to science and America coming together as one. But that seems to be like the less likely scenario at the moment. So having said that, I hope you're all ready, because I'm about to ask you what we think is going to happen in the election. This is where you have to all start being your forecasters, and I know you all have an opinion, but I want to go around the horn and ask people who they think is going to win, and I'm going to ask about particular states. And given we have 3 of you in a swing state, I think, am I carrying it right? And then one of you who's not in a state at all. Or he doesn't get a senator.
He still has electoral votes.
Oh yeah, sorry, I lied. They're electoral votes. They just don't have a senator.
Yeah.
Wait, how do you have electoral votes if you can't vote?
DC has electors.
We
so
have
does Puerto
electoral
Rico.
votes. We can vote. We just don't have a senator. Or
They don't have
other
congressional
And
representation.
Devin
you could
moved from
vote for
DC to
president.
California, so her vote matters about as
They
much.
vote for electors.
All right. So
As
let's
do we.
All right, so let's go on the horn. So Kim, I'm going to start with you. Tell us about Ohio. Who's going to win Ohio, and then tell us who's going to win the whole thing.
I hope that Biden can carry Ohio, but I'm not sure I've seen any polls that really suggest that's really viable. When I drive out in the streets, I see a lot more Trump signs and Trump supporters. And I live in a fairly liberal area, so I'm afraid to say that I think that Trump is probably going to carry Ohio again.
And what about the whole country? What about the actual college?
I can't, honestly, at this point, I can't separate out what I want to happen from what I think will happen. So I'm not going to jinx anything.
All right. My 2 Pennsylvania colleagues, you're living in the most contested, most swing states. Jane, you are the most coveted person in America, being a female college-educated female in the Philadelphia suburbs.
In Montgomery County, which was Republican until 20 years ago. A Democrat never won my county. This was the most Republican county in Pennsylvania. And we're the people Chris Matthews used to talk about, the soccer moms in Montgomery County. That's me. So I'm not, I was a fencing mom. But Biden will take Pennsylvania. I say that as a fairly conservative thinker. I'm not conservative, but my husband and I have been working very hard in Chester County and Montgomery County, and that he will definitely take where Raj and I live, the southeastern Pennsylvania. I think he will take Scranton too, notwithstanding the fracking stuff that went on in the debate. And he will take Pittsburgh because you got a lot of Medicare out there, and seniors are really worried about Medicare and Social Security, which under the pandemic economy, the trust funds don't look so good 4 years from now. So I do believe
the fracking issue, which they aggressively, Trump's aggressively brought up, is not going to move enough in Western Pennsylvania.
I don't think it'll move enough of the margin that Biden has right now to win in our state. I think that's true. I like Kim, I cannot predict Tuesday. But I will tell you why I have the background I have up just for 30 seconds. This is the sun on the George Washington's chair in Independence Hall, where Benjamin Franklin was wont to say, or quoted to say, as Washington handed the scepter over to Adams, the second president, in a peaceful transition. Benjamin Franklin says he looked at the sun on the chair and believed it would be a rising sun, not a setting sun, for a democratic republic. And that is, with the guns and everything we're talking about, and it's tough. I do hope that whether it's a second term of Trump or a Biden presidency, it will be peaceful. And right now I can't read it either. But I'm sure we will not know Tuesday. I will say.
But you're not giving me you think that Biden will win Pennsylvania, but you can't give a forecast for the whole electoral college, who's going to win?
I think there are some wild cards still. I think there are some Trump voters who aren't saying they're Trump voters right now. And I think, we've seen tightening going on. Arizona was much wider. Wisconsin had a big margin for Biden a couple weeks ago, and we're seeing tightening. So, there's some undercurrents, the stuff we've been talking about in terms of, social and civil unrest, the fourth pandemic, racism, systemic racism. It ain't gone, and genie out of that bottle. So on the day, I think most of the mail-in votes in the swing states, to Lygia's point, will swing more Democratic, but those won't get counted on Tuesday.
So we'll see.
Raj,
the other Pennsylvania voter here.
Yeah. So first of all, I'm not a US citizen. I'm still a British citizen, so no one cares what I think. So I don't have a vote. This is all opinion. Just to step back a little bit, if you think about what's happened in the last, 6-8 months, and how divisive the rhetoric has been of the man in the White House right now, it's crazy that we're even thinking that man would still be in whatever it is, 2 months' time. I mean, just common sense would say, no chance, he's out, it's going to be a landslide for Joe Biden. But that's not where we're at right now, which is even more scary. That, when he's saying it's rounding the corner, I mean, that's just dumb, right? And so for us to actually say that there is still a contest here, I don't understand it, right? And I think it says something about the Republicans, the Democrats, and the people in this country as well. And so I do believe that Biden's going to win Pennsylvania. I do believe that Biden's going to win the US, but I believe it's going to be long and drawn out. And in the UK, we have something called a hung parliament, where there is no majority, and that is the worst. Where it happened a few years ago with what's his name, Cameron, and then there is all this bartering that happens to try to make a government. Now that doesn't happen here. It's going to be long and drawn out, and it's going to be counting the votes, and that is going to be, I don't know if it's going to be a week or 2 weeks or a few days, but I think that is going to be the scariest moment in American history for many decades, in this kind of the further rhetoric that Trump is going to deal with. And quite frankly, I think how Biden deals with that is actually going to be really important. Like, how does he stand up to that? And how does he show himself as a president in waiting? Because that's how I see him, as a president in waiting through that period of, I think it's going to be 2 weeks, quite frankly.
Ajia.
A lot of what Raj said rings true. First of all, I will say, I know DC will vote for Biden. It votes more Democratic than anywhere else. And in fact, it's very, very rare that you do see a House, for instance, that supports Trump visibly. But when they do, they are over the top. I think that it is likely that Biden will win the national vote, but I am really uncomfortable and nervous about that transition period. And I worry that unless, and maybe even if, it is a ridiculous landslide, there will be a lot of fighting back and forth for a prolonged period, I mean, I worry that it could easily be until, I don't know, January. And there's sort of, I hold my hopes out that we'll have an answer and it's such a landslide that we can kind of move on and say, okay, looks like Biden won. But that may not happen. And if it doesn't happen, I think we all need to just tighten our seatbelts and hang in there.
Devin.
I'm in California, so of course this is a Biden state, right? Matthew, Zoya, like, do we have any doubt? No.
we have no doubt about that. Yes.
There's no doubt. I mean, there are pockets of conservatism and pockets of Trump supporters. And yes, when you see them, they're super loud and super proud. But they mostly hide, at least along the coast, and they will not win California. Without a doubt, California will go for Biden. I cannot bring myself to do a prediction. I can still actually remember exactly where I was sitting on election night in 2016, all the people that I was with, the feeling in the pit of my stomach, all the way through to the next day having to show up at work at HHS with my colleagues to know what had just happened. It was the worst feeling in the world. It was completely out of the blue. And I have PTSD. I'm just not, I'm going to be nervous about this. I'm going to do my best to make donations, make phone calls, make, whatever it is that I can do to help support a good result on Tuesday. But I will not make a prediction.
Vince.
Despite my pessimism on the virus.
Vince, you're quiet. We'll let you fix your mic. We'll go to Zoya. Zoya.
Yeah, so like Devin was saying, it's definitely Bernie won this state back in the primaries, and now it's going to definitely be a Biden state. But my concern is, so my parents actually live in one of the suburbs of Sacramento, and that's where it's light red still. I mean, when you go there, you see very viscerally these Trump supporters, and you're kind of laughing because they're all Sacramento flipped to blue about, I think, 5 years ago. And then, the whole legislature is blue, but when you look closely at the demographic, they're still red. So I'm concerned, I'm actually still voting in that county where, McHilton out of, I think it's District 4 where my parents lived, or County 4, he's a huge Trump supporter. So I'm concerned in who's gonna win that county. And then I think, nationally, I'm just as nervous as has been one of the sentiments of, when Trump won in 2016, I'm going to age myself, but I was still in college, and I remember the heat that came out. And so just as nervous as who's going to take what type of heat is going to come, especially in the millennial and Gen Z crowds that are, have some small sub communities on TikTok, on social media, on Instagram. So very, very nervous. I'm not going to just say who I think is going to win yet.
Vince, can we try it now?
Okay. So
fuss with your mic, you're sort of quiet.
Can you guys hear me now?
There we go. Yeah.
Okay. So I'll present an optimistic view of the election. I've been actually following it fairly closely. And what we've seen is a pretty consistent polling view over the country, and it's been 10, 12, 14%. At this point, Hillary was at, as I read, 5% out, and there was a tremendous amount of softening in the last week. We're not seeing that. So I'm going to stick my neck out and say I expect we're going to see a Biden landslide, and there really won't be an argument of fake polling or fake voting, and that I believe we'll actually see a relatively peaceful transition. There may be breakouts here and there, but I think that the spread is going to be so big that it's not even going to be arguable.
So I'd say, I mean, I'm closer to Vince's position than anybody else's. I sat down and looked at all the swing states with my friend Chris Nolan, who's another policy wonk, the day before the election last time. And when I looked down the list, I went, this is close, and more likely that at that point Hillary was spending money in Arizona and money in Texas. And I said, look, those upper Midwest states are close. This could go the other way. So I wasn't all confident. And I also was, if you remember, there's some very close Senate races. We'll talk about the Senate just a second. But it looks to me as though none of these places are just as close, and the ones that are now close are the ones that Trump would have counted on. So I don't think the Republicans will lose Texas. They might lose Georgia, especially as me and my wife read a bunch of postcards and sent them to do that, which may or may not make any difference the other day. And and then also Florida, which I think Pennsylvania is likely to go. Michigan's likely to go back to Biden. Wisconsin, you don't know. But if they win Florida, none of that stuff really matters. And Florida is looking like it might just edge to Biden at the moment. But this could all be wrong, and he'll win the national vote in a landslide, but may lose the electoral college. But I'm with Vince. I think it's going to be pretty much a landslide national vote, and a bunch of close swing states will go to Biden. So I'm more optimistic, although I don't think it solves any of the bigger problems. The other thing, which
Biden going to take Texas? Is it going to be that much of a
I don't think he's going to take Texas, but I think he'll get much closer. And in a couple of generations, Texas comes into play. Hopefully by then there is no such thing as electoral college. We don't have to have this stupid swing state debate, but that's another.
Count on it, dude. It's been around for more than 200 years.
Oh, there is a compact now. We just need to get enough states to
right.
vote it out. Anyway,
Right.
I know we'll all be dead by the time that happens, Devin. Last quick thing. We have a few minutes left. None of this stuff really matters in terms of healthcare policy, in my view, until we see what happens to the Senate, because we're talking about no further relief bill. The Senate's gone home. They're done with McConnell's done with his. He's got the judge, and he doesn't care about the relief bill. No significant changes. I mean, there have been rules coming out of Medicare as we discussed. No significant changes to health policy can be done unless there's at least 50 votes in the Senate plus the vice president. So I've been looking at this a lot, and I have my forecast. But Democrats have to take 3 seats in the Senate, but they're likely to lose Alabama. So really, they have to win 4 seats. There are 3 that look pretty obviously that they're going to go, which are Maine, Colorado, and Arizona. Look, they've been polling heavily Democratic. And there's a bunch of others that are sort of on the balance. North, South Carolina, Iowa are probably the obvious ones, but also the 2 Georgia seats. So quick yes, no going around here. The Democrats win the Senate with at least 50. Do we have any clear yeses, clear no's?
I think so.
Yes.
Yeah, I think so.
I think so.
I do.
So how many people are a yes on the Senate victory?
Yes.
Especially South Carolina, Jamie Harris and Lindsey Graham.
Yeah.
Okay, that one.
Please.
I've given money
People
for
are
that one.
making me
I love
so
that one
happy.
too.
Let's not forget Kentucky.
I love it. Oh,
I don't know.
He's
you're
way
all
behind.
optimistic about that. Kentucky's never happening.
I wish.
So I will the only one going on record saying is I think they're going to win those 3 seats. I think they lose Alabama, and I think all the other swing seats will stay Republican. So I think they're going to get to 49. And I think we're going to. Am I the only person who doesn't believe who believes this? I'm the only pessimist here. And look, I've spent money and sent podcasts and postcards and whatever else. But I think when they're this close, all those Senate races, it's going to be, hopefully I'm wrong here, but I think we're going to have a Biden presidency and still a Republican Senate. And that's going to be extremely unpleasant because we're going back to the case of can we get anything done? I mean, the House stays with the Democrats, but we still back to the place, can we get anything done? But at least there are things that from a regulatory and also, just executive order, executive branch functions, we can make a lot of changes, things like the environment, things like CMS, things like immigration, the management of immigration, even if we won't get a new immigration bill. But let me get to so if I'm wrong and everyone else believes that Democrats are going to win the Senate?
I make no bets.
Okay,
I just have hopes.
Devin, yeah, well, it's funny because I'm going to come back to you, Devin, here. So what's the likelihood that let's assume the Democrats win the Senate, they take a look at the Supreme Court, they take a look at what's happened to the federal courts, what's the likelihood that it's going to be, if not necessarily court packing, some alternate way that Congress is going to pass a law regarding the courts? What's your sense of that?
I think if the Democrats took the Senate, it could be very likely. I'm not sure it's the best idea, but it's a little bit like a nuclear option because that means the number of Supreme Court justices is going to fluctuate with every time we have regime change, which it has not done in many, many years. So but I think it's entirely
Well,
possible.
There was an interesting article in New York. I mean, you know about this stuff, and clearly I don't. But I saw an interesting article in the New York Times saying which had many different options for like creating a separate constitutional court and doing a bunch of other different things. They're adding one or two every year. Or changing the makeup of the justices based on the Senate, or every couple. There were a bunch of options you could do rather than just adding another 4 justices, which seems like the obvious thing to do. But you think that there's some likelihood to happen there?
It'll be a serious discussion. We'll sort of see how it plays out. But I think I would say that it could happen.
I'd rather they impeach Kavanaugh.
Seriously,
we just need to find out who paid off his mortgage and his credit card debts, and that'll be good. But I mean, we know who that was, right? In the end. Okay. And then last but not least, we have got like a minute left here. Prospects for what Biden has proposed is pretty major reform, right? Expanding Medicare, even if it's just Medicare down to 60, a public option, all the rest of it. If the Democrats get the 51 votes in the Senate and they get and they have the House, do we think that happens to healthcare over the next early part of January, February, March? Do we think we get the Biden healthcare plan through? Or do you think that they can't build a coalition even amongst the Democratic senators to do that?
I think he's got to deliver something big in his first 100 days. If it's not healthcare, I'm not sure what it would be. I mean, he's got to show all those left-wing people that he's there for a reason and he's paying off their support.
So Kim's a yes on that. Any other views?
I'm with you, Kim. And I've got to run, so thank you all.
All right.
Me too.
Okay. All right, well, that is our view. We're going to get some big changes. It's going to be a scary Halloween and probably an even scarier first part of next week. I want to thank all of my guests. Just to list of them again. It's been Matthew Holt, Death, your host for the Halloween edition of the THCB Gang. We have my colleague Zoya Kam, the THCB editor-in-chief, on with us. Raj Agarwal from Jefferson Strategic Ventures. Kim Bellard from the wilds of Ohio. Vince Corrales from the wilds of Idaho, Devin McGraw from rural California, up in the wine country now, Gira Cardi hanging out in DC, and of course Jane Saracen-Kahn, the archetypal soccer mum in the Philadelphia suburbs, telling us how she thinks Philadelphia's going to go. This has been THCB Gang. We'll be back same time, same place next week, where by then we should know, maybe, who's won the election. So looking forward to seeing you there next Thursday, 1 p.m. Pacific, 4 p.m. East Coast time. Matthew Holt signing off. Thanks for listening.